Good morning, ma'am. So, may interview ko, ma'am, about sa donor questionnaire. So, if nakatry ka na ba mag-donate or wala pa po, please complete using blue or black ink, not pencil, by placing a cross or tick in the relevant box. So, instead po, ako na po ang ma'am, i-question ko lang po kayo, yung isagot niyo lang po yes or no, or some questions may be not answerable by yes or no. Question number 1. Have you ever volunteered to donate blood before?
No.
No. Have you ever been advised not to give blood?
No.
Very good po. Have you ever had anemia or any blood disorder? Or a serious illness, operation, or been admitted to hospital?
Admitted eh.
Admitted to hospital. Question number 4. Have you ever been pregnant, including miscarriage and termination of pregnancy?
Pregnant, not miscarriage.
So, no. Have you ever had a head injury? Yes or no?
No.
Stroke or epilepsy?
One stroke in mild.
Mild stroke. Heart or blood pressure problems or chest pain?
Yes.
Rheumatic fever or heart murmur?
No.
Question number 6. Have you ever had bowel disease, stomach or duodenal problems or ulcers?
No.
Kidney or liver problems?
No.
Lung problems including tuberculosis?
Yes, not tuberculosis. Pneumonia lang.
Have you ever had diabetes? Yes or no?
Yes.
Thyroid disorder?
No.
An autoimmune disease, example rheumatoid arthritis or lupus?
No.
Question 8. Have you ever had cancer of any kind, including melanoma?
No.
Receive a transplant or graft organ, bone marrow, cornea, dura mater, bone, or etc.?
No.
Yes or no? Question number 9. Have you ever had jaundice or yellow eye skin or hepatitis? Yes or no?
No.
Malaria, Q fever, leptospirosis, or Chagas disease?
No.
Have you ever had treatment with the medication or nutigason or acitresin?
No.
Have you had question number 11. Have you had a neurosurgical procedure involving the head, brain, or spinal cord between 1972 and 1989?
No.
Have you received injections of human growth hormone for short stature or human pituitary hormone for infertility prior to 1985?
No.
What was your country of birth?
Philippines.
Have you ever been outside Australia? Yes or no?
Oh, yes.
Huh? Nakapalakat yung
No.
If you,
Kaya dahil.
sige. Question number 15. Have you spent a continuous period of 6 months or more outside Australia at any... if you answer question 14. Wala. Next question.
Ano na to?
Are you feeling, question number B1, are you feeling healthy and well? Yes or no?
Yes.
Did you have any side effects after leaving the donor center after you last donated? I know, no.
Not applicable.
If you answer yes, I know. Question number 3. Are you allergic to the antiseptic chlorhexidine?
Ano siya?
Antiseptic. No.
No.
B4. What is your weight?
58. Weight? 58.
Question 5. In the next 3 days, do you intend to participate in any activity which would place your others at risk of injury if you were to become unwell after donating, such as driving public transport operating heavy machinery, underwater diving, piloting a plane, or other activities?
No.
Question 6. In the last week, have you had dental work, cleaning, filling, or extraction, taken any aspiration, painkillers, or anti-inflammatory preparation?
No.
Had any cuts, abrasions, sores, or rashes?
No.
No. Question 7. In the last week, have you had gastric upset, diarrhea, abdominal pain, or vomiting?
No.
Question 8. Since your last donation, have you or... Ay, wala no, not applicable. Have you been in Papua New Guinea in the last 3 years?
No.
Since your last donation, have you been outside Australia?
No.
Since your last donation, have you received a transfusion or rejection of blood or blood products?
No.
Since your last donation, have you been pregnant?
No.
Balik-balik lagi ng question.
Nansuran mo.
Question C1. To the best of your knowledge, have you ever thought you could be infected with HIV or have AIDS?
No.
To the best of your knowledge, have you ever had tests which showed you had hepatitis B, hepatitis C, HIV, or HTLV?
No.
Question 5. In the last 12 months, have you engaged in sexual activity with someone who think could be infected with HIV and have AIDS?
No.
Had a test which showed they had hepatitis B, hepatitis C, HIV, or HTLV?
No, not applicable.
In the last 12 months, have you had sexual activity with new partner who currently lives or has previously lived overseas?
No.
Question 7. In the last 12 months, have you had sex with someone without a condom with a man who you think may have had oral or anal sex with another man?
No.
In the last 12 months, you had make sex, oral or anal sex with or without condom?
No.
In the last 12 months, have you been a male or female sex worker, received payment for sex in months, gift, or drug?
Kaya nga eh. Ano tanana?
Ano? Yes or no?
No,
Dali agad. Question 11. In the last 12 months, have you been imprisoned in a prison or been held locked up or detention center?
No.
In the last 12 months, have you had a blood transfusion?
No.
C13. In the last 12 months, have you had yellow jaundice or hepatitis or been in contact with someone who has?
No.
Question C4. In the last 4 months, have you been injured with a used needle?
No.
In the last 4 months, have you had body fluid splashed to eyes, mouth, nose, or broken skin?
No.
Question 16. In the last 4 months, have you had a tattoo, body, and or piercing or acupuncture?
No. Damo pa?
How? Okay, ma'am. Kunwari ay, ano siya, ma'am. So, if mag-donate ka blood, ma'am, pwede ka mag-donate kay, based sa mga answers, kay puro no, so therefore, siya ng, tawag siya na, pwede ka mag-donate of blood. Thank you, ma'am. Unsa ka na to full name po?
Bilya Jane Dumilig.
I'm your interviewee for today, ma'am, Precious Jane Dumilig. Thank you, ma'am, for complying with me. Thank you, ma'am.